What's up, everyone? Did you know that over half, well over half, of the United States population will experience some sort of low back pain at any point throughout their life? I'm Dr. Tanner with the Chiro Health team. Today I wanted to walk you through a quick exercise that can help mitigate some of that low back pain that you have throughout the day. A lot of the times when it comes to low back pain, if there's nothing structural going on, I always look towards the hips. The hips need to function properly, they need to be mobile, they need to be strong, and help solidify and help stabilize the low back. If our hips aren't mobile, the low back will try to be mobile. And when the low back tries to be mobile, it does not like that. And so this is called a flexion extension exercise I walk through with almost all of my patients with low back pain. It's going to ensure that we have proper hip range of motion, proper hip strength and stability on the side that's working, plus the side that's blended. So all you're going to do is you're going to stand on one leg, pick whichever side. You're going to end up doing both sides. You're going to raise one leg all the way up into full hip flexion. Then you're going to slowly move back into hip extension. You're going to move slowly again up and back. And you're just going to find a groove and work through those different ranges of motion. The hip that's raising up, again, is working into that full hip flexion. Work some of the hip flexors. And then on the way back, you're going to have to use your glute muscle to come back to help contract through there. And then this plant leg here, the whole entire time you're moving, those deep hip muscles that help stabilize the pelvis, help stabilize the low back, are going to have to work to make sure that we're not tipping over while we're moving this leg through that range of motion. Give this a try throughout the day. Balance is very important when it comes to low back as well. There's a lot of research that talks about the better balance that you have, especially standing on one leg, the less pain that you're going to have, the less hip pain, the less low back pain. Plus, it's also a marker of just overall longevity. If we can balance for 30 seconds on one leg, even without moving a leg through space, you're going to be in a much better position to do the things throughout your day that you want to do. Pain's multifactorial, though. We all know that. There's a lot that goes into it. It's very complex. And so if you're still wondering why you're experiencing a lot of that pain that you are in, that you experience day in and day out, please take advantage of our $39 donation. That goes to the charity that we work with every month, and that lets you sit down with one of our docs. We'll go through a full spinal tap assessment, functional exam, neurological, orthopedic, x-rays. All of that is to give you answers as to why you're in pain, why you're experiencing what you're experiencing, why you can't do some of the things that you can't do right now because of your pain. And then we'll put together a game plan to get you out of pain so that you can live that life that you deserve.